Hi, my name is Dr. Annie Alanese. I'm actually standing on the property of Pothawira, Safe Haven Christian Mission Organization in Salima, Malawi. So actually in the background of me is where we have the birthing center. So the organization was started many years ago after I actually went to the United States and was given a private scholarship. I grew up in the village, struggled for basic needs of life like clean water, health care. And so one of my goals after I finished getting my education in the United States was to be able to bring a little bit of the piece of what I found in the United States, which is the American dream. You know, the ability to have access to education, have access to good health care, and have access even to clean water and food. So Pothawira, Safe Haven, was actually born out of that. This was actually co-founded by me and my family. We're local Malawians. We grew up in this area. The large village outside of here, Maganga and Daniel Village, is pretty much the areas where we grew up. So the main district hospital here is a district hospital that serves about 500,000 patients. However, they are so under-resourced and very little staffing, and also very little availability of even antibiotics or surgical equipment. They have one main operating room and one minor operating room, and that's for a hospital that serves 500,000 people. So we opened a birthing center here because the maternal mortality rates in Malawi are very high. So one of the immediate issues that we saw as soon as we started running the maternity ward was the fact that sometimes we have patients that have emergencies, they need emergency care, surgical care. And we're having to now take the women in an ambulance and transport them to Salima District Hospital, which is already overburdened with a large volume of patients and not enough resources. Another example was we just came on this particular visit. I had patients that I saw about 3 years ago, some of them about a year ago because of COVID, and I couldn't make any visits here. There's so little subspecialized care for patients that there are women that have been waiting 3 years, for me and a team from the United States to return to be able to perform life-saving surgeries. We've actually already done 14 surgeries just in the last 5 days. And there's more to be done, and as the word is getting out, more and more women are coming. With one operating room available that serves 500,000 people in this area, it is not sustainable for us to continue operating in that way. So it's become very apparent that we actually need to add operating rooms to the facility that we have. Part of that will be to help the community in the area. It will also take some of the burden for Salima District Hospital. We have a collaborative relationship with them, and I feel like what we do here, and we've all agreed that what this organization does here also takes the burden from them. So that benefits the community, it benefits Salima District Hospital, it benefits our patients here that sometimes when they have to be shipped to the district hospital and they have a true emergency, that they find themselves waiting 24, 48 hours and sometimes even end up with a bad outcome simply because the operating room was not available because there's one for 500,000 people. We have a significant issue with cervical cancer in Malawi, very limited training for it. No GYN oncologists that are trained in Malawi. Most of the ones that are here are actually expatriates. So one of the things we have is we're initiating a cervical cancer screening program. It's going to allow us to be able to find the women that are high risk, immediately treat them, and then the ones that do actually find to have cancer, given the fact I'm a gynecologic oncologist, we're creating a team of doctors that will be able to come every 3 to 4 months and operate on these women. So this facility isn't just going to benefit the community here in Salima or just the hospital or just Pothawira itself. It's really a benefit even to the visiting surgeons. There's really something about giving yourself to someone that can never repay you that's truly life-changing. I think that this is a great place for people to develop perspective, a global perspective, true empathy, a real understanding of what disparities exist even between countries other than just within, the United States itself. The gaps in between what people have access to in the United States or here are so vast that I feel like the exposure that the physicians are going to have here during their trips and their visits are really going to be life-changing for them as well, and just make us better people and make us better global citizens. So I'm excited for us to be able to create this facility.